Hi there, I'm Karen Greenside, a genetic counselor and founding executive director of JScreen. Today we're talking about understanding your genetic test results and steps you can take with the information they provide. If you've recently received your results or are expecting them soon, here are some things you may want to know. When you receive genetic test results, they typically fall into one of three categories: positive, negative, or what we call a variant of uncertain significance. A positive result means the lab found a genetic change, also known as a variant or mutation, in one of the genes on the test panel. On the hereditary cancer test, a positive result indicates an increased risk for developing cancer. On the reproductive carrier screening test, a positive result indicates that a person is a carrier of a genetic condition. Carriers typically don't have symptoms of the condition themselves, but may have a reproductive risk, a higher chance of having a child affected with the condition. Determining reproductive risk often requires testing a partner to see if they carry the same condition. If you receive a positive result, remember, knowledge is power. This information allows you to take proactive steps for your health or for family planning. A negative result means the lab didn't detect any changes in the genes that were analyzed. While this is reassuring, it's important to remember that genetic testing doesn't test for everything, and when it comes to cancer testing, family history and other factors also play a role in your risk to develop cancer in the future. Sometimes the lab will find a variant of uncertain significance or a VUS. A VUS is a genetic change with limited information. Medical science isn't yet sure if the variant increases health risks. VUSs are actually quite common and often get reclassified as technology advances. So what happens next after you get your results? Again, if you test positive as a carrier on the reproductive screening test, it's likely that your partner should consider testing to determine if there's a risk for future children to be affected by the condition. If you both carry the same condition, a genetic counselor can discuss family planning options with you. Sometimes positive results can convey reproductive risk even if your partner isn't a carrier. That's why it's always a good idea to have a genetic counselor walk you through results with you. If you test positive on the hereditary cancer test, we recommend having a genetic counselor review your results with you to discuss the meaning of the result and guidelines for screening and management of cancer risk. Then your next steps might include creating a personalized screening plan with your healthcare provider, discussing risk-reducing medications or preventive surgeries, sharing information with close relatives who might also benefit from testing, or connecting with support groups for people with similar genetic findings. Most importantly, remember that you're not alone in this journey. A genetic counselor can help you understand your results, answer your questions, and connect you with appropriate resources and specialists. That's why JScreen makes genetic counseling available at no additional charge to people who test with us. If you have questions about your genetic test results or want to learn more about testing options, visit jscreen.org for more information. Your genetic information is a powerful tool that can help you take control of your health history and make informed decisions for your future.